So hello guys, welcome back to my channel MedPath with Piyush, and today we are going to start with a very important topic from pharmacology, that is blood pharmacology. जिसमें जो हमारा पहला topic that we are going to start with is the anti-platelet drugs. So we are going to target the drugs that are against the platelets. Okay, we are going to be studying blood pharmacology in two sections like anti-platelets and second will be anticoagulants. Okay, so today in this video we'll be studying antiplatelets. Okay, so firstly we need to understand some physiology and pathophysiology behind what happens when there is an injury to a blood vessel. So when there's an injury to a blood vessel, there is generally a vascular spasm or vasoconstriction that occurs. Okay, so if there is a breach in the wall, there will be transient vasoconstriction. Okay, after that vasoconstriction occurs, there is a platelet plug formation. Okay, the platelets come there and they get adhesed there, so there is platelet adhesion. Okay, platelet adhesion, okay, to exposed collagen of damaged endothelium. You will understand this much better when you have studied pathology. Okay, in pathology there is a whole chapter based on hemostasis. Okay, if you want a video on that, do comment down in the comment section and I'll make a video on that as well. And thirdly, last is the blood coagulation that occurs via intrinsic and extrinsic pathway, that is actually targeted in anticoagulants. Coagulants. Okay, in this video we are going to target this step, that is platelets. Okay, so that platelets don't work. But before going to that, I will still give you an overview of what is blood coagulation system, intrinsic and extrinsic pathway, so we don't have to revise it in the next video that is going to probably come tomorrow. Okay, so there are two pathways. There is an intrinsic pathway and there is an extrinsic pathway. In intrinsic pathway, there is a surface contact. Once there is surface contact, there is a plethora of reactions that occurs. Okay, so firstly the factors that start getting activated is the factor number 12. So you can easily remember this by 12, 11, 9, 8 and 10. Okay, it's in a decreasing order. Just remember that 10 comes in a common pathway. Here is 10. 10 is a common pathway. Okay, so 10 will come afterwards. So 12, 11, skip the 10, then 9, 8. Okay, 12, 11, 9, 8 and then 10 will get activated, and along with 8 there is phospholipid and calcium also that acts. Okay, that is intrinsic pathway. For extrinsic pathway, there should be a tissue damage. When there is tissue damage, there is activation of tissue factor. Okay, tissue factor is known as 7th factor. Okay, so 7th factor gets activated and that will activate again the 10A. Okay, when the 10A get activated, then there is the common pathway. Okay, for common pathway you just go 10, 5, 2, 1. See, 1 into 2 is 2, 2 into 5 is 10. Okay, 1 से 2, 2 into 5 is 10. Okay, easy to remember. Okay, this is very easy to remember. Okay, so 10 से 5 को यूज़ किया, 5 के साथ भी कैल्शियम एंड फॉस्फोलिपिड विल बी यूज, 2 will get activated and 1 will get activated. Only one important thing to remember is that 2A, that is thrombin. You have to remember this name, that 2 is actually prothrombin and activated form is thrombin, and 1 is actually fibrinogen and 1A is fibrin. Okay, so once 2A gets activated, it will also convert 13 into 13A. Okay, and 13A is actually fibrin stabilizing factor, so it will stabilize this fibrin clot. Okay, so when we use fibrinolytics, they actually act at this step by decreasing fibrin stabilization as well. Okay, now let's come to antiplatelet drugs. So there are different mechanisms by which platelets act. So okay, so first one to remember is there is arachidonic acid inside platelets. What that is acted upon by COX enzymes. When we'll study autocoids, okay, then we'll study that arachidonic acid is being acted upon by COX enzyme, which is cyclooxygenase 1 enzyme, that converts it into thromboxane A2, and that also converts it into many other prostaglandins as well. But the one of the most important that we need to remember in this video is thromboxane A2. Once it gets to thromboxane A2, there is platelet aggregation. Okay, that means thromboxane A2 is a plus factor for platelet aggregation. So we will try to stop the formation of thromboxane A2. Okay, drug is also mentioned here, but what you need to understand from this diagram is actually the drug targets. Okay, which are the drug targets that we are targeting. Okay, second is thrombin. Okay, once the thrombin gets activated, there it is in platelets. Okay, it will act on PAR or protease activated receptors. So we can give thrombin receptor antagonist or PAR antagonist. Secondly, thirdly is ADP. ADP. Okay, what does ADP do? It acts on its receptor P2Y12 receptor. Okay, you have to remember both things, P2Y12 as well as ADP receptor antagonist. Okay, इससे होता क्या है? It will cause the influx of calcium, and once calcium comes, there is upregulation of GP2B3A. This is GP2B3A, and what GP2B3A does is, I will show you here. There is one platelet. This is GP2B3A. This is GP2B3A. Okay, there is another platelet. This is again GP2B3A. Okay, when calcium comes, there is regulation of this, and in between there is fibrin. So fibrin comes in between them, and there is platelet aggregation that occurs. Platelet starts aggregating. Okay, platelet aggregation starts. So you need to remember this. Okay, so we can target this P2Y12 as well as we can target GP2B3A. Okay, and can target fibrin. Okay, fibrin receptor antagonist, but these are fibrinolytics. Okay, this will be fibrinolytics. Okay, what is the problem? If there will be spontaneous platelet plug formation, we need to use antiplatelets. So what are the conditions that can occur that in which we need to use antiplatelets? There can be MI, there can be unstable angina, stroke, peripheral vascular disease, and intermittent claudication. So actually what we are seeing here are actually uses of antiplatelet drugs. When they are asked to you need to give these drugs, these conditions. Okay, got it. Next we come to drug targets. I've already told you thromboxane A2, ADP receptor antagonist, PAR antagonist, GP2B3 antagonist, and one important is phosphodiesterase 3 inhibitors. We'll talk about what phosphodiesterase 3 inhibitor does at the last of this video. Okay, now firstly starting with thromboxane A2 inhibitor. So the drug here is aspirin. Okay, aspirin is irreversible COX enzyme inhibitor, COX1 inhibitor. Okay, so I've already told you there is arachidonic acid and there is formation of thromboxane A2, and the aspirin, what it will do in its low dose, what is its low dose? 50 to 325 mg. You need to remember that in low dose it acts as antiplatelet action by inhibiting COX1 enzyme. If it is a higher dose, it will act as anti-inflammatory and not as antiplatelet. So you need to remember this. Okay, in low dose, this is important point. Okay, and if it acts, it will act for entire lifespan of platelets, that is about 7 to 10 days. So with that you get the duration of action. The duration of aspirin is around 7 to 10 days. Okay, its T half is only 30 minutes. So what are such type of drugs called? The drugs which have T half less than duration of action. Okay, let me tell you another. T half less than duration of action. Such drugs are known as hit and run drugs. Okay, so means they come, they act, they go, but their action will stay for a long time. Okay, the trick to remembering drugs that come under this is GROMA. Okay, what is GROMA? Guanethidine, R for reserpine, O for omeprazole, M for MAO inhibitors, and A for aspirin that we are studying. Okay, so remember this. This is important. Can be an MCQ question for you, or can be a short note on hit and run drugs. Okay, now next point is, if the patient is planned for elective surgery, then if patient is on aspirin, then stop the aspirin 7 to 8 days prior to surgery. Why is this important? I've already told you that aspirin has its duration of action for about 7 to 10 days. So if the patient is planned for surgery, you cannot do surgery while the aspirin is still acting. So you need to stop the aspirin prior to surgery about 7 to 10 days back, okay, and shift to a short acting antiplatelet drug that is not acting for a small time, and do the surgery after a week. Okay, wait for 7 to 8 days, stop the aspirin, shift to some short antiplatelet drug, and then do the surgery. Okay, otherwise there will be bleeding manifestations, okay, because of antiplatelet activity. Okay, what its overdose is called? See, overdose is known as salicylism. Okay, aspirin can also be named as N-acetyl salicylic acid, N-acetyl salicylic acid. That is why its overdose is known as salicylism. ओके, सो ओवरडोज में जैसे मैंने अभी बताया क्या क्या हो सकता है, ब्लीडिंग हो सकती है, हेमरेजेस हो सकते हैं, फिक्स्ड ब्लड एरप्शन हो सकती है. ओके, इसको ट्रीट कैसे किया जाएगा? हाउ विल यू ट्रीट इट? इज लाइक बाय यूजिंग फोर्स्ड एल्कलाइन डायूरेसिस. एल्कलाइन डायूरेसिस करते हैं बिकॉज एस्पिरिन इज अ ड्रग which is acidic in nature, so you will do forced alkaline diuresis using NaHCO3 and carbonic anhydrase inhibitors. Okay, now ये तो था कि thromboxane A2 के direct antagonist, but there are two types more. One is receptor antagonist. thromboxane A2 बनेगा तो सही, बट अपने रिसेप्टर पे काम नहीं कर पाएगा, तो उसमें ड्रग आती है टेरिट्रोमैन. ठीक है, मेजर जो अपने याद रखने वो एस्पिरिन ही है, बट अदर्स कैन बी टेरिट्रोमैन, and one is thromboxane synthase inhibitor, that is desoxyban and pyrimexal. Okay, you don't need to much remember these drugs, but do remember aspirin, as there can be a short note on this as well. You will study it in more detail in NSAIDs in autocoids. Okay, next we come to next category of drug, that is ADP receptor antagonist or P2Y12 antagonist. This can be of two types. One can be irreversible and other can be reversible. So let's study the irreversible first. There are three drugs that come under this. You can remember them by PCT. Okay, PCT is in our college referred to as part completion test. Okay, part completion test. Okay, so P for prasugrel, which is one of the most important drugs, C for clopidogrel, and T for ticlopidine. Okay, these are important. For ticlopidine, only point you need to remember is it is associated with neutropenia and thrombocytopenia. Okay, प्लेटलेट का डिक्रीज करा देता है एंड न्यूट्रोफिल्स का डिक्रीज करा देता है. ठीक है, while clopidogrel और prasugrel are not associated with neutropenia. Okay, एक important point जो आपने याद रखना है कि all the irreversible P2Y12 inhibitors are prodrugs and they are activated by CYP2C19 into active form. That is why they are contraindicated to be given with omeprazole, which is a proton pump inhibitor, because omeprazole is a competitive inhibitor of CYP2C19. Omeprazole will inhibit CYP2C19. It will not let them be metabolized into their active form, so they cannot be given together. Okay, while in reversible, you need to remember the Grelor type of drugs. Okay, Grelor, Cangrelor and Ticagrelor. These are not prodrugs. Okay, and they are safe with omeprazole because they are not prodrugs, and they can be continued till a day before surgery, while they have to be stopped a week prior to surgery. Okay, अब talking about prasugrel. Prasugrel is the most efficacious. It is fastest acting. It has a high risk of intracranial bleed. That is why it is contraindicated in patients with stroke. Although we use antiplatelet drugs in stroke, but you cannot use this in stroke here, because if you use it in stroke, there is a high risk of causing intracranial bleed. Okay, TIA and history of intracranial bleed, as I've told. Okay, next receptors that become is GP2B3A antagonist. Okay, what it does is it decreases the platelet cross-linking or platelet aggregation. Okay, I already told you the mechanism when we were discussing about drug targets. Okay, drugs that come under this is epsiximab. The most important is epsiximab, tirofiban and eptifibatide. You need to remember these names. These are important names. Epsiximab, tirofiban and eptifibatide. Epsiximab is the strongest antiplatelet drug known. Strongest antiplatelet drug. It is also available in injection form. These are contraindicated in hemorrhagic shock because there is already too much bleeding. Hemorrhagic stroke, sorry. cerebrovascular disease, and history of intracranial bleed. Okay. Next, coming to thrombin or PAR receptor antagonist, you only need to know the names etopaxar and vorapexar. So these are actually Pexar type of drugs. You can, PAR and Pexar. So you can remember it by easily. And what will they do? They will inhibit thrombin to act on PAR. As the thrombin will not act on PAR receptors, platelets will not be able to adhere. Okay, they will decrease the adhesion. Okay. Next we come to last category of drugs under the antiplatelet drugs, that is phosphodiesterase 3 inhibitors. Firstly, you need to remember their names, that are dipyridamole and cilostazol. What you need to know majorly is dipyridamole. Okay, dipyridamole. Okay, how does they act? Let me show you here. Firstly, there is an endothelium. Okay, these are endothelial cells. They secrete PGI2. Okay, and you remember what does PGI2 do? It is already an antiplatelet. Okay, it is antiplatelet. Okay, like thromboxane A2 was pro-platelet. Okay, doing coagulation. Okay, this is not causing coagulation, anticoagulant in a way. Okay, so how it is inhibiting platelet aggregation? Okay, PGI2, what will it do? It will increase CAMP and CGMP. Okay, once they are activated in blood vessel, they will cause vasodilation. ओके, फर्स्टली एक तो वेजोडाइलेशन हो रही है, यही अगेंस्ट है प्लेटलेट के. ओके, सेकेंडली क्योंकि हमने पढ़ा था कि जो प्रोसेसेस होता है उसमें क्या होती है, वेसो कंस्ट्रक्शन होती है इंजरी के केस में, इसमें वेसो डायलेशन हो रही है. सेकेंडली दे डिक्रीज द एडीपी रिलीज. ओके, अगर ये एडीपी के रिलीज को डिक्रीज कर रहे हैं तो ये ऑटोमेटिकली एंटीप्लेटलेट है, बिकॉज एडीपी कर क्या रहा था, P2Y12 पे एक्ट कर रहा था. एंड व्हाट डज इट डू, कैल्शियम को लेके जाके GP2B3A को अपरेगुलेट कर रहा था. ठीक है, तो ये सारा प्रोसेस इनहिबिट हो गया. ठीक है, PGI2 की वजह से. ठीक है, तो ये एक्ट कैसे कर रहा है, बाय CAMP एंड CGMP. इफ phosphodiesterase 3 will act, they will get metabolized. Phosphodiesterase 3 metabolizes CAMP and CGMP. Okay, so we don't actually want that. We want the antiplatelet action to occur. So we'll give inhibitors of phosphodiesterase 3. Okay, that is dipyridamole and cholesterol. ठीक है, cilostazol and dipyridamole, they will inhibit phosphodiesterase. There will be ultimately increase in CMP and CGMP. There will decrease ADP release and increase vasodilation, and that will cause antiplatelet activity. Okay, one important thing that is associated with dipyridamole is coronary steal phenomena. Okay, that is important. Firstly, you need to remember that it is also seen with another drug that is known as adenosine. Okay, it's also seen with adenosine, and it is seen with phosphodiesterase 3 inhibitors of platelets, that is dipyridamole. Okay, how does it act? You need to see here. Firstly, see, in a normal case when there is stenosis here, okay, the blood will flow from the right side if left is stenosed. From right side it will flow to the normal area, also to the infarcted area via collaterals. Okay, but if you have given a drug like dipyridamole, ठीक है, आपने डायपिरिडामोल जैसी ड्रग दी है, तो क्या होगा, देयर विल बी अल्टीमेटली वेसोडाइलेशन, क्योंकि डायपिरिडामोल क्या करेगा, डायपिरिडामोल क्या है, फॉस्फोडाइस्ट्रेस 3 इनहिबिटर है. इसने इसको इनहिबिट किया, इससे इंक्रीज हो गया CAMP में और CGMP में. इसके इंक्रीज होने से वेसोडाइलेशन हो गई और ADP इनहिबिट हो गया. अब जब वेसोडाइलेशन हो जाएगी यहाँ पे, तो बहुत सारा अमाउंट ऑफ ब्लड यहीं से फ्लो कर जाएगा. It will flow more to the normal area, more blood flow to normal area. अल्टीमेटली जो कोलेट्रल्स पे ब्लड जा रहा था वो कम हो गया, एंड दैट इज वाई ये जो इन्फाक्टेड एरिया या इंस्टीमिक एरिया था, इसमें और ज़्यादा नेक्रोसिस हो जाएगी एंड और ज़्यादा ये डैमेज्ड हो जाएगा. ठीक है, अल्टीमेटली गेटिंग मोर इन्फाक्टेड. ठीक है, सो दैट इज कोरोनरी स्टील फिनोमेना. So guys, that was it for this video. These were all the drugs that you should know in your mind. Okay, the most important thing to remember is this diagram, by which you can remember all the mechanisms, and then just remember the names of drugs. So thank you guys for watching this video. If you liked my teaching, please comment down below, encourage me to do more teaching, and like the video if you enjoyed it. Subscribe to my channel for upcoming updates, and if you want video on any topic, then do comment it down in the comment section. Thank you for studying with me. Bye bye till the next time.